Ooh.
Hello, Maggie. Welcome to the
Hi, girlfriend. It
podcast.
is such a pleasure and an honor. Thank you so much for having me.
I know I'm so excited. We've been trying to plan this for like 2 years.
Yes,
And you know how life
exactly.
goes.
And today's the day. It's really happening.
I'm so excited. And I think everyone can really benefit from this episode and everything that we're going to talk about. So, why don't we dive right in and have you introduce yourself and then, talk a little bit about the Wild Collective?
I love it. My name is Maggie. I'm a nurse practitioner. I'm dual certified. So, that means that I am certified in family medicine as well as psychiatry. And I do have my own private practice for mental health. It's called Wylde Collective. Um, the goal with Wylde Collective is to not only offer medication management and therapy,
Mm,
but to kind of have some community outreach, some pop-up events,
yeah.
make mental health more accessible, fun, trendy, because let's face it, everyone deals with mental health. So let's
Yeah.
stop pretending like some of us don't. And make it something that that could perhaps, be less cold and sterile and clinical, and maybe just, more, dare I say, like fun and inviting.
Yeah. Yeah, I think that's so important, like that initiative to break the stigma and release that notion that there's something really wrong with me, or, obviously when you're struggling and, you're doing it alone, you might not feel like you can ask for help, or that there is like this scary place that you're stepping into. So I love that your initiative is also like making it fun and supportive and, just a different vibe than like walking into like what people see in the movies or something, like lay on my couch and I'll prescribe this medication to you.
Yes. And it's wild because everybody that does visit me in my office thinks that they're the only one, and I have the unique perspective of like so many people
Literally.
that are
Exactly.
coming in and out thinking that they're the only one. No, it's everybody at some point in your life, whether it be something that's diagnosable or not diagnosable. You have mental struggles, you have, traits, emotions, thoughts, behaviors that are maladaptive, that are causing you problems. So why not, just be open about it and kind of connect on that level and be able to help people.
Yeah, yeah. I know that later in the podcast, we are going to get into like when to really take that next step and ask for that higher level of care with medication. So I'm really excited to get deeper into that. But first, I want to talk a little bit more about you and your story of how you went from working in the hospital as a nurse to then wanting to become a nurse practitioner and then into like mental health care.
Yeah, of course. So actually that would have been like a long time ago. I wouldn't have imagined that I'd end up in psychiatry.
Mhm.
Just because of, how psychiatry is portrayed.
Yeah.
But I started out as a licensed practical nurse, that like medical assistant, licensed practical nurse, literally ground up. And I've always loved nursing, once a nurse, always a nurse.
Yeah.
I got into cardiology, and I was working in the cardiac cath lab for a long time. I became a nurse practitioner, and really kind of realized when I was in cardiology that I was spending a lot of my free time like reading Brene Brown,
Yeah.
reading Ram Dass,
Yeah.
reading Carl Jung, and like then I'm just kind of like, wait a minute, like this is what I'm actually super interested and passionate about. I
Mhm.
like the heart. I like
Yeah.
cardiology. It's pretty easy. There's plumbing, there's electric. It's,
Yeah.
but like that kind of really human part of the brain, and like there's something just different about that type of medicine.
Yeah.
So I got very interested in human consciousness, and kind of collective human experiences and things like
Yeah.
that.
Yeah.
And so then I remember the moment that I was like, oh my God, I have to go back to grad school again. And I was working in the cath lab, and I went back to grad school, and I got my postmaster's for psychiatry. And I went actually right into private practice.
Mhm.
It's allowed me to kind of have a more one-on-one experience with people.
Yeah.
Um, I had at that point become disenchanted with hospitals, with working in hospitals.
Yeah.
And so I was ready. Yeah, I was ready to kind of move into an office. But I worked for a couple of different private practices. And then 2 years ago, I stepped out on my own, and
Yeah.
Wild Collective, formed. So
Yeah.
that's kind of my story.
I love that. Yeah, that's so amazing. I'm so happy for you just to see you flourish and like do all the things that you're, doing because I
Thanks
know
a
that
lot.
you have overcome so much too. You've worked so hard to get here. Um,
Thanks.
I know one pivotal moment in your life, which I definitely want to talk about, is how like the mental health struggles that you were experiencing, even just being a nurse in COVID during COVID times.
Oh boy. So, wow. Yeah, that is like the epicenter of mental health, I think, for a lot of
A lot
people.
of people.
Yeah, that was really, if you had never had a mental health struggle before, you were gonna have one during COVID.
Yeah.
So at that time, I was a registered nurse. I was an RN. And I was working in the cardiac cath lab. Half of us were assigned to be deployed into the COVID ICU. So it was dedicated. It was only the new COVID patients, and I was in that half. And so it was incredibly difficult. It was traumatizing to see human beings that way. We didn't have a lot to help them
Yeah.
because we knew so little about this virus.
Mhm.
I had never seen, and don't get me wrong, I've worked in ICU for a long time.
Yeah.
I've seen a lot of horrible, scary things. I've seen life threatening and life ending, ultimately, things. I've never seen anything like this virus.
Yeah.
This virus was, it caused people to kind of almost not look like themselves anymore.
Mhm.
We were choose not, we were kind of having an algorithm of who would get a ventilator and who would not get a ventilator. So
Yeah.
there was just that like uh
That's traumatizing in
fallout.
itself to even
Yeah,
have to be
exactly.
responsible for something like that.
Exactly. And then afterwards, to be honest with you, I didn't feel any of that while it was happening. And
Yeah. Total
and
fight or flight.
yeah, exactly. And it was just kind of like head down, let's just do what we can do. And it was really, there was beautiful parts of it that just like you are so connected to
Yeah.
your teammates
Yeah.
because it's like this shared trauma bond.
Yeah.
But you are, there was that kind of beautiful part. And I remember, things like um, they would play Rise Up. I don't
Oh
know if you know
yeah.
that song. They
Yes,
would
I
play
love
that
that
through the
song.
speakers. They would play that through
Yeah.
speakers while we were working.
Oh my gosh.
Um, and they would play like Hero,
Yeah.
through the speakers while we were working. It was just things that were really nice like that.
Yeah.
But the whole experience of wanting to save people so bad, and we couldn't.
Yeah.
Like there was a lot of people that we couldn't save because we didn't know what we were dealing with, and we and
Yeah.
we didn't, ultimately make the right choices, I think, because we didn't have the information.
Mhm.
So that was difficult. I only spent about 2 months there.
Mhm.
That was enough. And then I went back to the cardiac, to the cath lab. And that's when I felt it.
Mhm.
Like it was like I was fine. I'm like, oh, I guess I'm getting out of this pretty unscathed. This seems like a
Yeah.
traumatizing situation, but I'm walking through it, functioning, able to go home and take care of my 18-month-old child, by the way,
Yeah.
and still go to grad school and still do all this. And then as soon as I left the COVID ICU, I cried for 6 weeks,
Yeah.
and I couldn't function, couldn't operate.
Mhm.
It was like it was I felt it afterwards.
Yeah.
And so yeah, that was definitely pivotal. And it really like kind of made me really understand how difficult it is to go to work and be expected to function
Yeah.
when you have like the pain level of like an arm hanging off,
Hmm.
but nobody can see that.
Yeah.
It's not something that you can say like, can I please go home, my arm's hanging off.
Yeah.
It's like you're expected to go on because
Yeah.
this pain that you're feeling is not visible and there's no
Right.
proof that you're having it.
Yeah.
And I think that's a lot of what's wrong with understanding people's mental health struggles,
Exactly.
is that like if you can't see it, it's like just carry on, just
Right. Just stay
function, just
strong and push through
you
it.
just figure it out, white knuckle it,
Yeah.
and it's not possible. You can't.
Exactly. Yeah.
Yeah. So that was rough. I'm very happy to have that in my past. But
Oh my
um
gosh. Yeah.
but yeah, totally formative experience too. And like I said, beautiful moments came out of it, and just like for the whole world to be collectively going through something together, I'm not sure if we'd ever do that again. Like it was just
Gosh.
a wild times, right?
Yeah, it really was. It really, really was. And I think like a lot of conversations still involve talking about like that time period, like whether
Mm-hmm.
it's something that you navigated mentally or like a lot of people that I speak to, even like on the podcast, they talk about how they went through this like huge transformation during that time and
Yeah.
myself included, and it was actually the first time I was able to slow down and I realized like, oh my God, I've actually been on the go so much that this is actually time that I can like let go and heal and like
Yeah.
spend time on myself for the first time in a long time. I think a lot of people have a lot of different stories connected to that time.
They really do. And then it changed people. I mean, it changed most of us, I think. And there's like
Yeah,
the before times and the after times. And it's like
right.
there was kind of two ways to go with it. Some people didn't, kind of came out and had really rough times
Yeah,
and didn't spend that time so productively. Some people were like, oh my God, like I have all this time. I don't have to go, and the world doesn't fall apart. I can actually just sit here and like paint or like
oh,
read a book or like
literally.
enjoy life, and just it was kind of forced us to do things just for the joy of them again. So there
Yeah,
was that little silver lining too, I think.
yeah, it's very true. Yeah, exactly. And just what a way to like dive deeper into like yourself and connect a little deeper with yourself too, like
Yeah,
I
yeah,
could just think
absolutely.
back of all the things that I was processing and going through at that time. It was just, yeah, it was a lot. Um, when you started working in private practice, like how did it feel to transition from doing more physical health care to then doing mental health care?
Yeah, so it was interesting because I was so enamored with all of the medications involved and the advancements in medications, all of the complementary modalities, how you can kind of hack your nervous system,
Yeah,
body like bottom up techniques, breath work, yoga, everything that kind of like, how do you, because in hospitals it's always, let's make sure that the body's still literally alive, like the heart's
functioning.
still
Yeah,
beating, end of list. That's all
yeah,
we care about.
yeah,
But it's more like, how do you put more life into your years, I guess.
yeah,
And like are you happy, are you enjoying your life, are you spending it anxious, are you spending it low, sad, in despair, do you find, and so I was so enamored with that whole shift, from just keeping a body, biologically alive and not really caring about the life in, the body. And that shifts to like, how do we not only live biologically, but how do we also really live a life? And how do we um, make ourselves enjoy the time that we have here? And so, yes, I was so enamored with that shift. But it was the reason that it was interesting is just because of the world that we live in and how society views psychiatry. And
Yeah.
even, going from cardiology to psychiatry, a lot of my coworkers, my colleagues, a lot of doctors were like, "Oh, wow, you want to go to psychiatry?" Like, oh my God. And I'm thinking to myself, like, do you think you're excluded from
Yeah.
psychiatry? Like that idea blows my mind. Like many people think that they don't need to be concerned with mental health.
Yeah.
Um, that's not the case.
Literally.
It's everyone, if you can get sick physically, you can
Mhm.
get sick mentally.
Yes.
We go to checkups, we go to annual checkups to check in,
Yeah.
check our cholesterol. If we do get an illness, we get treated.
Yeah.
The brain is no different. So like we all have a brain, then psychiatry is for you.
Yeah.
You can have periods where you get sick short term, mentally.
Yeah.
You can have a chronic illness where out of nowhere you're going to have an exacerbation and you need help, you need support, you need treatment.
Yeah.
So yeah, it's like it always reminds me of like, do you watch The Office?
Oh, the love The Office. My favorite show,
I
literally.
knew
My
I
favorite.
knew it. um so yeah, it was like telling my colleagues that I was going into psychiatry. It felt like, them feeling like they were kind of like, oh, that has nothing to do with me. Felt like when Dwight Schrute was like, don't need it, perfect immune system, never been
Right.
sick. Like, all right, okay, stop it, come on, grow up.
Yeah.
um so yeah, it's like I felt like, in my soul, in every bone in my body, I understand this and the need for this
Mhm.
and how to help people with this. But there's not a society has not developed that insight into themselves sometimes needing this. So it's interesting.
Yeah.
It's like kind of me. I feel like me yelling into the void a lot. But still carrying on the good fight and trying to get the message out that absolutely everyone should be, doing practices, things that can make sure that they're healthy mentally. Like, let's say, physical health. If you're not sick, you're still exercising, you're
Right.
still eating, you still have to do the things that make you healthy.
Yes.
Same with your brain. If
Yes.
you're not sick, you still have to be reflecting, you still have to be looking into your thought patterns, you still
Yes.
have to be adjusting things that are no longer serving you, maladaptive behavior, things like that. so
Exactly.
so that's, everyone kind of needs to be doing the things that keep them physically healthy. They need to be doing the things that keep them mentally healthy,
Yeah.
even in the absence of illness.
Yes. I love that. I think that is like literally, if I could put an explanation point, boom, like that is so important. And then it really brings me into the topic of then not going the proper channel, not using the proper channels to get diagnosed, reach out for help, or understand their mental health in a way that's, from a professional. So a lot of people are seeing online on social media, like everyone getting on social media talking about their symptoms, talking about their life, or, all these people who have no expertise or professional education behind them speaking out on mental health or specific mental illnesses and specific symptoms, diagnoses, all of that.
Yeah.
I always talk about this that, like, yes, it's great to, like, not feel alone, and social media can be so positive where you're putting out their information to feel like you're not alone, but it's so important to, like, not use that as a professional diagnosis or professional help or whatever, right? And you have to advocate for yourself and go see a professional. So
Yeah.
I want to talk a little bit about that of like, how to properly educate yourself on your own symptoms and when it's important to reach out for help, maybe when you are struggling and you might need a higher level of care of medication and not to just run to TikTok.
Absolutely. I know. And don't get me wrong, I love TikTok too.
Yeah,
Um, and I do love a lot of things about social media. But there are a lot of horrible things about social media, specifically with like getting misinformation out there, specifically medication
yes,
misinformation. And it really seems like it's true. Like they can say like study says blah blah
yeah,
blah blah blah. You have to examine studies and have like you have to have background in breaking those studies down. But the headline is grabby, and
yes,
people like click on, oh my god, I will die if I do this, and
yes.
so that's going to get clicked and then they just won't do it. And so I think, to answer your question, as far as like day-to-day things, like I was talking about, just maintaining like healthy habits. I think
Mhm.
like wellness coach, life coach, anybody, like people who, I think that's something that you can help people without like a degree. You can help people, like
Yeah.
you can, teach that type of thing.
Mhm.
Um, thing like how to, breathe in a certain way that is calming. And if it feels good to your body, then fabulous, go for it.
Yeah.
Um, when you're having symptoms like persistent low mood, persistent
Mhm.
emotional heaviness,
Mhm.
when you're having ruminations, fear-based ruminations that are taking up a lot of your day,
Yeah.
when you're having excessive worry that's completely out of proportion to the stressor.
Mhm.
Um, and I think um, the ultimate kind of litmus test for when to see a professional is, if it's starting to get in the way of your functionality or
Mhm.
your ability to enjoy your life.
Mhm.
And I wish people would see me then when they first noticed that.
Yeah.
But stigma being stigma, and like there's not a lot of welcoming psychiatrists. There's not a lot of comfortable places to go. So I do understand like delaying care. I totally understand that side of it. But once it's getting in the way of your relationships, your ability to do your job, once it's taking up most of your thoughts during the day and getting in the way of your quality of life, it's time to talk to a professional.
Mhm.
And so that way we can kind of just do an evaluation. Maybe it's a diagnosis, maybe it's not a diagnosis. I
Mhm.
don't put a lot of weight in the name anyway.
Right. Yeah.
The name's the name. Sometimes it can help people, you know look it up and see how many people experience the exact same thing. So
Yeah.
like that is huge. I think that's such a beautiful
And
thing,
there
and you're
are a
like, oh
lot
my
of
god.
symptoms that overlap and everything. So
Oh my
that's,
God, it's like a mosaic, always. It's like,
literally, and that's where people don't realize that if you're not like a professional and like you just look at like one diagnosis and you're like, oh, people love to throw around like the negative stigma towards like specific like mental illness of like, bipolar disorder or
right.
schizophrenia or whatever. Like, they'll like to like throw those some of those symptoms around and like act, oh, I must be bipolar or something like. Well, actually,
Absolutely.
like stop throwing that around because it's some people really do have that diagnosis and it's serious. So, yeah.
Absolutely. My favorite is OCD. People be
Yeah.
like,
Oh
oh my
my
God, I
God.
love my closet in order. I have OCD.
Yeah.
And you're like, you have no idea how
You
crippling that
really,
can be.
right.
Yeah. And so yeah, getting an appropriate diagnosis if there is a diagnosis present.
Yeah.
But like I said, the name is cool. Like sometimes people, like I'll be able to, I've seen this a million times before. This is called this, and they'll look online and they feel less alone. They have a community of other people that
Yeah.
deal with it. I think it can be a double-edged sword, because then sometimes, eventually it's limiting, and you can be like, oh, I can't do this because I have this, and that's not the case.
Right.
It's almost like having, high blood pressure or like any physical, ailment. It's just like, it's something that you manage. That's yours to manage. It doesn't have to get in the way of anything, that you're doing in your life. It doesn't have to
Yeah.
be the reason that you don't do so and so. It doesn't have to be the reason that, you're acting a certain way, or it's just something that is yours to manage. But yeah,
Yeah.
it can be like, I often hesitate to really name something, because there is that sense of community, and they're like, oh my God, I understand myself so much better. But at the same time, there can be that like, I can't do this, and this because
Yeah.
I have generalized anxiety disorder.
Right. Right.
No, it's, you can live a full normal life, and not, and honestly, most of the time, not have any symptoms with proper management.
Right.
Um, and it doesn't get in the way of anything. So,
Yeah.
so yeah, that's my kind of very long-winded answer to, that's when you kind of seek help from a
Mhm.
professional, is when it's getting in the way. It's getting in the way of your life. I wish people would come immediately, but I usually see them when they're like
At the
2
worst.
years into that, like,
Yeah.
2 years into that or so, where it's like
Yeah.
last, like, and then we're kind of chasing symptoms, and it's a little bit harder to treat, because um some of the medications we're working with are slow moving.
Mhm.
They take a little while to start. So that's
Yeah.
another reason that it can be really helpful to get a head start on things.
Yeah. And I think that's a good point too, because like obviously, like I don't do medication management, but as I'm working with clients, they're talking about, their experience with medication with me like week to week or whatever. And so
Yeah.
like something like I've noticed, which I'm sure you have too, is that a lot of people get frustrated or discouraged because they're like, oh, the medication's not working. I feel like it's not, whatever. But it's like, you don't know until you know. Like, I feel like for the most part, like, you can really you do your research on the medication and, because I've been around, practicing with you or,
Yeah.
other like I worked with a really great child psychiatrist for a long time and she taught me so much too. So even from like children and then adults, like I have experience working side by side with a lot of psychiatrists and like I can tell when they're like doing their research of like, oh yeah, like this medication really helps with this symptom and like that
Mhm.
symptom and or like this, diagnosis or whatever. And but sometimes it's like just trial and error. Like you can really be confident in knowing like, oh, I feel like this is a great recommendation for you because XYZ. But then, the
Yeah.
client comes back and says, actually, I don't feel like the best. Okay, then we pivot and and then
That's
you finally feel, oh great, I'm on the right medication for me. Yeah.
Exactly. And I think you touched on a point that is so important, which is that often people can be discouraged after having maybe a bad experience with one medication. Let's say they try an SSRI. One thing that people are always very concerned about is weight gain, which I understand. Sexual dysfunction is another
Yeah.
one. Like those are two intolerable, side effects for people, which
Yeah.
is understandable. And it does occur in, it's less than 10%. But let's say you have that experience, you stop the medication, the side effect stops, right? That's, it's just, that's not for you. We've stopped it, side effect goes away. But then they're done. Like
Yeah.
often they're like, medication's not for me. When in fact, you switch to a different medication in the same class, you likely won't have the same side effect.
Yeah.
In It's like, not only are you is there a chance that you won't have the same side effects, it's likely that you will not have the same side effects. So it's kind of like, we have these a couple different tools, and if one's not right for you, we pivot to the next one that could fit like a glove, and like make you feel like yourself again, and optimize your whole being for the rest of your life, and you just kind of quit after the first trial. So yeah, you touched on, that happens all the time, where it's like, nope, medication's not for me. when in fact, it just, that one wasn't for you.
Yeah, yeah. Yeah, I think it's so important and these conversations are so important and great because then it helps with our mission of just normalizing the mental health and just making it feel like it's not taboo or that, there's nothing wrong with you or that, it's normalized. And that's
Yeah.
why I'm very vocal on social media about what I struggle with because I don't want anyone to ever think, oh, you have your life together or your mental health is amazing just because you are a therapist and you help other people. Well, actually,
Right.
no.
Same. Yeah, exactly.
Actually.
Exactly. It doesn't work that way. Absolutely. No, and I think too, like there's like two really common misconceptions that lead people away from proper treatment. I think the first one is that, and this is very common on TikTok, on social media, is that if you do these things, if you diet, if you have a proper nutrition, if you
Right.
exercise, if you do breath work, if you get sunlight, if you get adequate rest,
Yeah.
you will have no problems. And
Right.
that's simply not true. Um, Whether it be physical health, mental health, you can have the most pristine of lifestyles and you can get sick. So that was like the biggest surprise for people when they would come in having a heart attack in the
Yeah.
cardiac cath lab. They would be like, there's no way. I exercise. My nutrition is dialed in. I get hydration. I sleep enough. There's no way.
Yeah.
And your genetics don't care. Your
Right.
genetics do not care.
Literally.
You can have high cholesterol. You can have high blood pressure. If you don't, and that just because you do,
Yeah.
just because you got it, you got high blood pressure.
Yeah.
And so, if that goes unchecked long enough, if that goes untreated long enough, you can have a heart attack.
Hmm.
You can have a stroke. So it's like, yes, don't stop your nutrition, your exercise, your sunlight, your adequate rest. No one wants you to stop that.
Yeah.
But sometimes you need to add medication into the mix. There's nothing,
Exactly.
like, medication is kind of vilified, I think, by that community
Yeah.
that believes that you can't get sick
Yeah.
if you do all these things right.
Right.
It's not a failure of yourself or anyone else. If you end up, it's biology and it's genetics, and that's just the way it is. And the same thing applies to mental health,
Yeah.
where it can be really frustrating to see people online just like, well, all you have to do is, eat these nutrients and you should be fine. And that's not working. And the breath work's not working. The
Yeah.
exercise is not working. And it's just like, what's wrong with me?
Yeah.
Nothing's wrong with you.
Right.
Nothing's wrong with you. It's just like, you can't decide you don't have diabetes. You
Right.
can't decide you don't have anxiety.
Literally.
So
Exactly.
it's just thankfully we have the medical advancements that we have, that
Yeah.
you can take a medication and it goes away.
Right.
Like, and they're very benign medications. They're very safe medications that we work with. Certainly some of them we need to monitor parameters,
Right.
but like, thankfully we have these things that, like, yeah, you have this condition, but we can treat it.
Yeah.
The second misconception, in addition to like just living a pristine lifestyle is all you need to do to be healthy.
Mhm.
The second misconception, I think, is like, it's called the naturalistic fallacy,
Mhm.
where people believe that natural is superior to man-made.
Right.
And it comes from a good place, because I think it's like, we want to, we just trust this beautiful earth that we live on, and of
Yeah.
course it has given us so much. So it's like, um things from the earth must be better than, quote unquote, chemicals,
Right.
when in fact, when you say things are like, oh, there's all these chemicals, everything's a chemical.
Yeah.
Everything in your body is a chemical. Water is a chemical. Like, it's
Yeah.
just like that, like, it's dihydrogen oxide is
Mhm.
water. So like, there's nothing that's not a chemical. That's
Yeah.
how chemistry works. But I think then at that point, the argument would be, yes, but man-made chemicals, like, I'm talking about man-made chemicals. And even that, it's just, poison ivy is natural, penicillin is man-made. So it's like there's a naturalistic fallacy where natural is better. You should always have things that are just from the earth or things that you're doing with your body, exercise, movement, sunlight, rest. And don't get me wrong. Yes, 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 yes. Check, 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 check.
Of
Please do.
course. Yeah.
But man-made, synthetic chemicals, they they work with your entire body is chemistry. Your
Yeah.
entire body is chemistry. It works with chemistry. And medication can complement that chemistry so that you can live literally, like the data shows, the research, the statistics all show, longer, happier, healthier lives.
Yeah.
That's why we have, much longer lifeline or lifetimes than we used to have because
Right.
of man-made chemicals, right?
Right.
So I think those are the two things that turn people off to getting help is that it's not natural. And then also just that, like, I could be doing something better. I could be breathing more. I could be working out more. But you're not doing anything wrong. If you're struggling, then there's help and there's support for you, and it's so common, and
Yeah.
I just, those are kind of the things that I hope people realize.
Yeah, and I love that. Thank you so much for sharing all of that too, because I think the combination of supporting yourself with medication and doing all the things that, you need to
Yeah.
do to go underneath the surface and, work through what's happening outside of symptom management is really important, taking care of yourself, going to therapy, recovering from whatever, has gone on in your life previously and currently and all of that. And the combination is that like you said, like living a life that like worth living, that feels good to you, that
Right.
you feel confident in, and there's nothing wrong with asking for help and that you're not alone.
Exactly, exactly. I always end up going back to, like, I can't shut off the cardiology part, but I
Yeah, I
always end
love
up
it though.
going back to, like, if someone like has a heart attack, you're not like, well, you can choose medicine or diet and exercise.
Right.
It's like you should take medicine and you should diet and you should exercise. Like, they're not
Exactly.
mutually exclusive.
Right.
And this is not, medication for all. it's
Mhm.
it's if you are finding yourself that it's inhibiting your lifestyle, your ability to
Exactly.
function, that kind of thing, then medication might be something to add in. But
Mhm.
but yeah, certainly they work very well together. Medication can also really help therapy land,
Yeah.
because I don't know if, like, you've ever experienced where you are just so overwhelmed or you're so low, like, your brain's not absorbing, your brain's not
Mhm.
creating new circuitry. So
Yeah.
it's it's it improves neuroplasticity, it improves the
Mhm.
ability for your brain to rewire itself
Mhm.
if you are in those places of super activation, high overwhelm,
Yeah.
anxiety, or very low, having a hard time getting out of bed, brushing your teeth is a whole thing.
Right.
It'll
Right.
actually make therapy land, so much more effectively.
Absolutely. People always ask me like, "Oh, like what is your recommendation? What is your opinion?" And I always say like, obviously like I do not have the degree to be able to recommend like medication for you. That is something that you have to go out and seek out like a specialist for that. But I always say I have been doing this long enough to where I've seen my clients not be on medication and be able to do whatever, and feel better in their lives. But I've also seen people bring in medication and their lives are forever changed. I've seen
Yeah,
people like function so much better being, taking that next step. So it's a personal
exactly.
choice, but it's one that you don't have to keep fighting.
Exactly, exactly. It might be right for you, it might not be right for you, but yeah, it's like it's there. It's
Yeah,
in the toolkit. It's in the toolkit. We have that to work with.
exactly. I love it. And I've just loved this conversation so much.
I
And
always love all of our
I
conversations, but
know
yes,
everything.
I've enjoyed this so much. Thank you.
Yeah. Yeah. So where can everybody find you if they're looking for medication management, supporting you online, and just learning more about you?
Awesome. Yeah. So I usually just recommend my Instagram. So it's going to be at wylde. Wylde is WYLDE, and that's and then underscore collective. That's my Instagram. I also I do have a website which is www.wylde-collective.com. But that's the easiest way to get me. I think Instagram is probably even easier. I do also I like to post free resources,
Yeah.
breath work, things like that.
Yeah.
We talk science, medical misinformation,
Mhm.
and facts, and so that's probably the best way to find me.
Yeah, I love that. Learning more, just like starting to surround yourself, with information from a professional that is so important. So that's great.
And that information is always far less scary than the other information. The other
Exactly.
information is just like this will kill you. This will do it. Like so like it's like no 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 no. So yeah, it's just like actual information like that's not misinformation is far less horrifying.
Exactly. Yeah. Well, thank you so much, Maggie. This has been amazing.
Thank you. Thank you. Thank you. This was wonderful. I love this.
Yes.